Hey guys, Dr. Julia doing a video today about trauma. I am not a mental health professional. I am a chiropractor. However, I stumbled upon my ability to see trauma patterns in patients after doing their nervous system scan. I think that's really important because I wasn't seeking that out at all. But I'm really sensitive to it, and I feel like so many of my patients are comfortable with me talking about their trauma. And so it gave me this insight. So when I see a scan of somebody I've never even seen before, because we do scans before we even see the patient, I started to see these crazy patterns in people, and they were just, it was too obvious to me not to say something. And so I never pretend like I know what's going on, but I definitely want to see if there's a correlation between the pattern that shows up in the nervous system scans and the person's actual real life situations that they're dealing with. And the reason why is because trauma and undealt with trauma causes the fight or flight complex to explode. And we stay in fight or flight. If we stay in fight or flight, we're in protection mode. When we're in protection mode, we cannot heal our bodies. Plain and simple. Your body will not heal if you're stuck in fight or flight. That goes with relationships, that goes with work environment, that goes with kids, that goes with yourself, that goes with misalignment in your life and not doing your true calling. I mean, there's a million things. Eating things you know you're not supposed to because it makes you sick or it makes you gain weight or whatever. Like, those are all things that feed trauma because they're a lot of times linked to trauma responses. And so your body reacts. The most simple way I can put it is your nervous system is perceiving Metallica when there's elevator music outside, okay? So outside your body, there's nothing, but your body does these life-saving techniques and says, oh, you need to pay attention to this. You need to pay attention to this. Even if it's not something that should be causing your body to perceive a threat, okay? That is a broken link between the brain and the body. When we perceive threats as toxins, thoughts, and traumas outside of our body, and then we feel like we shouldn't react the way that we're doing, which also creates a fight or flight response. It's not your fault. Like, your nervous system is perceiving for you and then reacting, and you're just like, whoa, what the heck? Anxiety attack or major depression or whatever it is that you're dealing with. Avoidance of people. That's a really common one lately. So these reactions that your nervous system is having and feeling anxious all the time, which that's the majority of the reason why I even address this, because a lot of people mark down that they have anxiety. So I want to show you what a trauma pattern looks like in somebody. This is a patient that I'm getting prior consent. You won't know her name or anything like that. And I'm not going to give details about her life. However, I will be pretty ambiguous when I describe this. So this is somebody I've been seeing for quite a long time. And we just rescanned. It's easy to get in your wellness care, and then sometimes we forget to do scans. So it's been a while since she's had a scan. And if I'm being honest, like, I have a protocol, but we don't always follow it. So that's the reality of life. So I said, hey, let's do a scan. I feel like we need to see what's going on with you. And it's so interesting because, I'll show it to you first. And this is going to be a little awkward because you can't flip the picture. So we're just going to kind of go with this. Okay, so this is the scan. And what I want you to see here is that she has these green lines at C2 right here. And then there's a break like along this area right here. So C4 and 5. And then she's got another break at T6, 7, 8, and 9. And then it kind of goes down and then the lower, okay? So your parasympathetic plexus is right here, L1 to S1, but overlapping mostly at L5 and S1. So your parasympathetic plexus is your brake pedal. It's your body's brake pedal. It's your slow down nerve response to your nervous system's perceived threat response, which is the fight or flight complex. This is also upper cervical C1 is the parasympathetic plexus 2 and is a brake pedal as well. So what do we see here? C2, C3. Okay. So what's really interesting is I happen to know that she's going through a decision right now. And I didn't know that prior to seeing her scan, but it's about moving, and she's really confused, like she doesn't know if she wants to do that or not. And so C2 and C3 represent indecisiveness. So there's definitely something there. And then you see that big white kind of block right here at C5 all the way to T6. In a normal scan, we want to see that really balanced, but on the right side, it's kind of a big chunk. Well, that's your shoulder, right? And the big chunk there should be nice and broken up bilaterally, really even. And it's not. And the reason why is because this choice has to do with her career. Your right side represents your masculine, and the shoulder represents burdens. So it's common for people to have shoulder pain with work-related stress. And work-related is usually a masculine thing. So it's the way you make money. It's protocols. It's procedures. Those are all very masculine things. So in the middle is T7, T8, and T9 with a breakaway there. That's where the adrenal glands have their spinal nerves that come out of the spine there and go to the organs. So there's definitely some adrenal activity, lower adrenal activity, and then it swings back over to the right side with digestion, so processing. She's processing, your guts process, your colon, that's where the nerves are for that. And this right here is processing, making decisions, being indecisive, processing. So these can be interpreted in many different ways, but this is how I choose to interpret it, and I think it's accurate. And then down here we have the parasympathetic plexus. This is your foundation, S1, that brake pedal. So in looking at that, the body is reacting to her indecision about her foundation, the way she makes money, how she's processing that, how she's holding it, how she's handling it, and then the decision. Okay, so what does that have to do with trauma? Well, there's another part of this where she is dealing with a decision with her mother, and she actually was quite intuitive to this prior. Like, she didn't know this was coming, I don't think. But I was like, what's going on with your mom? You know, because your neck is mothering, right? And the left side is feminine, which is where her C2, C3 kind of green markers are. And that is, it could be mothering yourself too, but because I know this patient, it was kind of like, oh, but maybe it's your mom. And lo and behold, there's a trauma response that she's dealing with. And one person is leaving and then another person is coming in. So it's really fascinating to see it kind of play out in her life. I think this is all going to be good stuff, but it's also a chance to release her trauma. And what I do, like what a chiropractor could do for trauma, is when the nervous system has shut down the brake pedal. So you're on the gas all the time. You don't have enough influence from your brake pedal, then you can't slow down your stress responses. So you'll always be in protection. When we hit the brakes and we train the body, we reestablish the patterns, we increase the frequency of the nervous system's potential for healing, your nervous system takes over. And when that gas pedal and brake pedal, when your gas and brake are balanced in the middle, that's when you reach adaptation. That is when you adapt to stress far more easily. Your nervous system stops perceiving threats everywhere you go and really starts to help you integrate. And so what I like to say is that I help integrate trauma. Trauma doesn't go away. The things that happen to you do not go away, but they can be integrated so your nervous system doesn't always perceive everything as a threat. It's just lovely. And I love that I was able to stumble upon this, and I was so excited to be able to help people with this. And so I'm sharing this information because I really feel like it's so necessary right now. So if you have trauma that you are either currently working with a mental health counselor for, or you are looking to just feel more at ease, maybe sleep better, maybe get rid of those sugar cravings, maybe gain some muscle, burn some fat. Those are all things that when the hormones are not working how they should and you have too much adrenal stress hormone in your body, those things don't work. And so you can't get out of pain. You can't sleep. There's so many things. So keep in mind that, again, this would be trauma integration. This would be helping your nervous system acclimate better to the things that trigger your trauma responses and just get better and feel better. That's what we're looking for. Okay, I hope you have a wonderful day, and I'll see you soon.